Let's start that list. We'll talk about each of the drug in much more detail. So first drug is aspirin. Aspirin is a very good drug, right? It can be used for particularly to decrease inflammation, but it also has moderate analgesic and antipyretic effect. So aspirin, it is good for pain and fever. However, uh, the dose that we give in this case will depend, right? For example, for so the pain and fever, right? We have aspirin. Okay, not like this. Let's start with the onset of action. So the onset of action, it start within 30 minutes. Okay, it depends upon person to person. Aspirin is again an acidic drug. More acidic the system will be, more faster it will act, right? And the drug peak level, peak effect, you can observe within 1 to 2 hours. And whole duration of action is somewhere around 4 to 6 hours, right? And we just said that it has the best antiplatelet effect and it affect irreversibly, right? It was irreversible antiplatelet effect, and this antiplatelet effect last for about 10 days, right? Because it was an irreversible drug, so a new platelet has to be formed, right? And it roughly takes about 10 days to produce new batch of platelets, right? So we were talking about the pain and stuff, right? So if a person has pain or fever, right, because it was moderately affecting both, somewhere around 325 to about 650 milligram can be given every 4 to 6 hours, right? Maximum you can go, so let's keep it over here. Max dose is 4 gram per day. Now you can divide this 4 gram per day depending upon how much amount is available to you in that particular drug, and according to the timeline you can divide that, right? So the next is anti-inflammatory effect. Anti-inflammatory effect is somewhere around 3 to 6 gram per day. So I know we just said that the max dose is somewhere around 4 gram, but you can stretch it up to 6 gram for anti-inflammatory if you're using aspirin, right? Okay, then we have the anti-platelet effect, 6 gram per day, and this 3 to 6 gram per day is not like one dose, it is in divided dose. However, we don't use the anti-inflammatory property of aspirin because the dosage is so much high. We have to switch to some other class of the same NSAID category in order to achieve the antiplatelet action, right? Though the potency is very high, but still 3 to 6 gram is not nice for us. The antiplatelet effect, right? Antiplatelet effect is the main thing that we use for aspirin because this thing will help us for cardio protection. Overall load on the heart decreases, right, in the cases of high mortality rate. So about 75 to about 150 mg once a day OD can be given, right? Now there was one more thing that we talked about, that the aspirin, right, was having the highest gastric bleeding occurrence rate, right? So how much dose it will take to have that? So talking about the GI bleed risk, right? For aspirin, right? Low dose at 75 to about 100 mg, right? Second will be about moderate risk at around 300 to 500 milligram per day, and high risk. These all are risk, okay? These all are risk plus how much long term use. In short term use, you can use this drug, there's no problem at all. Now for high risk is somewhere around like more than or equals to 1 gram per day. So the max dose was about roughly around 4 grams per day. These data may again vary from it depends upon which type of book you're reading. It's a Google or KD Tripathi or whatever. These values may differ, but the average values are these only. Okay. Right. So overall, more than if you're going like more than 1.5 gram per day, you will be at a higher risk to cause the GI bleed. So we just said that we need about 3 to 6 gram per day, okay, for the anti-inflammatory effect, that too in divided doses, in order to achieve the anti-inflammatory property. So when we do that, there will be high risk to cause the GI bleed, because GI bleed will occur somewhere around 1.5 milligram per day. For pain and fever and the antiplatelet effect, there is no rule at all. These all are milligrams. This is about gram, right? And this is again like gram. So for the pain and fever and the antiplatelet effect, no problem, you can give. However, if there is some sort of bleeding, right? Let's say there is an intracranial hemorrhage, you suspect that there is some sort of intracranial hemorrhage, please don't give this drug just for pain, because during the intracranial hemorrhage, the patient might have high pain, okay? So just have a clearer history before giving somebody aspirin, that to a high dose aspirin in such situation, because it can even worsen the condition of the patient. Right, so at high risk, there will be much more occurrence of all the side effects. So we must check for history of any ulcer or gastritis, right, before advising somebody aspirin. Also, we should check whether the patient have alcohol consumption or not, that too like chronic alcohol consumption. And lastly, H. pylori infection, because all in these three major conditions, the severity will be even much more to cause the GI bleed. So in all these situations, even high risk to cause the GI bleed. Right, so we have already talked about that there will be GI bleed, right? So how to stop that? In order to stop the GI bleed, we give PPI, right? The PPI depends upon how longer the action we need, probably. There are different types of NSAID depending upon, let's say, the duration of action. For the aspirin, somewhere lasts around 4 to 6 hours. So in this case, the omeprazole, right? Omeprazole will help the patient. However, you can use any of them, but why to suppress the acidity of the patient if there is no need? Okay, suppress as you need. Okay, don't suppress so much or so less. It won't be that much helpful for us, right? So you can use the Rayprozole, omeprazole, pantoprazole, whatever, but the best one for aspirin, go with omeprazole. So whenever you advise somebody aspirin, so whenever you prescribe aspirin to somebody, try to adjuvate it with omeprazole, right? It will help the patient. Right, now in India, there are different sets or types or the availability of the aspirin, right? So let's talk about all of them. So first is the Ecosprin. Ecosprin is again aspirin, which contains roughly around 75 milligrams of aspirin. Okay, usually it is used for our heart, which is the cardio protection. Right. It also comes in like 75, 150 milligram and 325 milligram. If you suspect that the patient is at high risk, start with the high dose. If you think that the patient may develop some cardiovascular event, start with the low dose. Okay, keep on continuing it, right? So accordingly, you can shift on the dosage of the Ecosprin, right? So this was the first one. Second one, well known, is the Disprin. Disprin is also the aspirin. It contains roughly around like the regular one. Okay, the Disprin that we use is somewhere about 300 milligrams of aspirin. Also, Disprin comes for the cardiovascular use, right? You can use Disprin for cardiovascular use also. Vascular use at around 75 milligram. Okay, this available of there is drugs in this type also, 150 milligram. So these type of Disprins are also available in the market. Now the aspirin, the generic aspirin that we use, right? Aspirin, the general one that we use. You can go to the pharmacy and ask for aspirin, not the Disprin. Aspirin, 325 milligram, right? This is the regular aspirin. Now you can go up to like 500 milligram in this set, right? Also for the headache, few years ago there was this Saridon, which is a combination of three things, right? It was like not Disprin, the aspirin, paracetamol, and caffeine, right? Caffeine. You can use this very good drug, right? So it contains roughly around like 250 milligrams, about 250 milligrams paracetamol, and roughly around like 500 milligram of caffeine. So yeah, this is the 4 type. There are also some more combinations available in the market, but these are the main one, right? So yes, this is the all about the aspirin. Also there can be overdose, right? And what to do in overdose we will talk about in some other lecture, but this was all about aspirin overview that you can use. Try aspirin in very limited amount, right? Unless you don't have some particular condition in which you have to give the aspirin. Because of this thing, right, antiplatelet effect and high gastric bleeding, this is not so much suitable for regular pain and fever, right? There are also some better options available in certain situations, ibuprofen, paracetamol, and so on. So we can use those instead of aspirin, right? And if you have to use aspirin, go along with the omeprazole, okay? At least you will have a less side effects of aspirin. For the side effects, we have already discussed that prolonged use, okay? Not like one single tablet will not cause so much trouble for you. If you're having a fever, you can still go with the Disprin, or the better option, go with the Saridon, right? Saridon has about 250 milligram. The Disprin will have about 300 milligram of aspirin. So this was aspirin. Right, go with the Saridon. One tablet will be enough, but if you can go with some experiments on yourself. If paracetamol works better for you in headache, go with the paracetamol instead of aspirin. So yes, this was all about aspirin.